All right, hey ho, let's go. My name is Dr. MarkAlain Dery. I'm the Medical Director of Infectious Diseases and Chief Innovation Officer for Access Health Louisiana. I live in New Orleans. I serve as the co-chair for the ACOI Infectious Diseases Subspecialty Section. You've seen me do these updates now for the past lot of months in conjunction with the leadership of the ACOI. And I hope these messages are helping you to keep up with the latest on COVID-19. I know that many of you are in the thick of the fight. I'd like to thank each one of you on behalf of all of us who focus daily on infectious diseases, and certainly on behalf of the ACOI. Moving together with the ACOI, we will continue to share information as it becomes available, as well as some of the hopeful progress that we are seeing. All right, so on to the stories. Misinformation is a global health threat. Happy New Year. Happy New Year, because yes, it's 2021, and it's too bad that we can't party like it's 1999. In fact, in the famous words of Prince, time is a mind construct, it's not real. And here's a fun fact about a little MarkAlain Dery who was growing up in a house of Jewish African immigrants who immigrated to the U.S. My brother and I were not allowed to have clocks or watches in the house. So trust me, when I say time is a mind construct, it's not real. That's really real. And I will say this, while it is great to not have this construct of time in my brain, it's also very annoying. Just ask my wife. Okay, so even though it's 2021, we must keep a 2020 mindset that until we've reached herd immunity, our behavior is the best way to control the pandemic. And of course, the way to reach herd immunity is vaccine. Yes, like so many other ACOI members, I got my vaccine and I'm thankful. I love seeing all of your pictures online. It's wonderful and inspiring. And I am super thankful to the scientists and researchers. Have you looked up Dr. Kiezmikia Corbet yet? She's amazing. Look up Dr. Corbet. As well as all the clinical trial participants, which is why I must comment about the vaccine misinformation that's being spread on social media. Okay, now, before the coronavirus pandemic, the World Health Organization had labeled vaccine hesitancy, that's the reluctance to get vaccines even when they're available, as one of the top 10 threats to global health. But with this misinformation and the way it's spreading on social media, we need to truly see that these posts as global health threats. So now, of course, when I trained in medical school and residency, specifically residency to fight global health infectious diseases threats, I think that it's pretty safe to say that none of us, certainly I didn't, and was not trained on how to fight infectious diseases. Rumors that propagated on social media, in fact, just like you probably, there was no such thing as social media. Yet there was no less powerful or dangerous, and as healthcare providers, the best thing we can do is to state the facts and to not be shy when it comes to educating our patients, our families, and our friends. In fact, it's the basis of principle-centered medicine. So principle number 1 states, focus on health and well-being, and principle number 6 says to address complexity. And misinformation is a complex issue, and I do want to address it. Now, anti-vaxxers have used private Facebook groups to convince mothers not to vaccinate their children. That is a terrible, terrible case, and it's horrible to even have to read it. And when I'm reminded about it, it breaks my heart because there have been some untoward outcomes that have occurred as a result of that. Now, there's also been some coordination of social media harassment campaigns against doctors who explain the medical benefits of vaccines. This false rhetoric of today isn't new, and sadly, it's been escalating. There's even a group called the Center for Countering Digital Hate, and their estimation of anti-vaccine accounts on social media platforms have gained more than 10 million new followers just since 2019. And of course, that is terrible timing given the 2020 pandemic. So we need to be very clear with our patients that both the Pfizer and Moderna vaccines each went through a series of rigorous clinical trials. More than 75,000 people received each vaccine in the final phase of the test, and both vaccines were found to be more than 95 both found to be 95% effective at preventing COVID-19 with no serious safety concerns. Let me also say that since the filming of this video, which is today, January 7th, there's been something like 4.1 million people also vaccinated as well. And again, there's been no safety concerns. Since widespread distribution has begun, there's only been a few cases of recipients who've had an allergic reaction to the vaccine. In fact, the CDC had just released a report this week documenting that anaphylaxis is occurring at a rate of 5.5 per 1 million doses given. This is a low rate indeed. For me, I had a sore arm for about 24 hours, and I was pretty much wiped out the following day. Now, remember that adverse effects of vaccines are more pronounced with the second dose, so please know that for yourself, and please warn your patients about this as well. Now, the funny thing is that I'm usually talking about super spreading events in these videos because I love super spreading events. There was a massive super spreading event that happened yesterday in our nation's capital, so that'll be very interesting to see what happens. Okay, but this time I'm talking about a super spreading event in a different way, but that's equally as dangerous. Now, Facebook has long been resistant to take down any anti-vaxxer information, but early in December they said that they were going to be more aggressive about it and they were going to crack down on it. They pledged to instead direct people to more authoritative information from legitimate sources. But the problem is, here we are a month later and false claims are still easy to find on Facebook. Do they have a thumbs down? And many posts with misinformation do not have additional warning labels. So while many of these platforms are making pledges, it's like plugging a leaky dam. So I'm with all of you all to spread truthful scientific fact. And my hope is that we can increase the momentum of getting individuals vaccinated with the same haste, disarm those who spread vaccine falsehoods, and who are threatening our ability to put this pandemic behind us. Here's to better days in 2021. Okay, so very quickly, for our second story, we're going to quickly talk about these new virus variants because we are going to start hearing more about them. And I do have a feeling that they're going to possibly be some more of the more dominant strains. So a few weeks ago, we talked about this more infectious strain of COVID-19 that was first spotted in the UK. And of course, not surprisingly, we're now seeing it spread to the US. Scientists in the UK estimate that this new variant is 40 to 70% more infectious based on analysis of those in Britain. We have at least 5 states in the US, California, Colorado, Florida, New York, and Georgia, and 33 countries have been identified with this new variant that's currently referred to as B.1.1.7. Now, my friend Dr. Fauci, my good friend Dr. Fauci has said that it is more contagious because it's more easily able to bind to the ACE2 receptors on cells, which makes transmission easier. Now remember, the mutation is happening on the spike protein. So here's your spike protein, right? Here's the spike protein, and let's say this is what this is what it looks like now, right? This is the spike protein. Well, the new strain, let's say, looks like this now, and that new configuration of the spike protein makes it 40 to 70% easier to get into those, to bind with the ACE2 receptors, which of course means getting into the cells easier. Now, fortunately, this new strain is not more lethal and does not cause more severe disease. It is believed that the current vaccine will likely protect against this new UK strain, but more data is needed to be certain. So again, more contagious, not more lethal, and very likely the Moderna and Pfizer vaccines will be able to protect against these new strains. But essentially, the virus will likely need to accumulate multiple mutations in the spike protein to evade immunity induced by vaccines or by natural infection. So in other words, for this particular strain. Now we're going to talk about the South Africa strain in a second. There's not such good news with the South Africa strain, but at least with this virus, this strain, what we are seeing is that there needs to be greater and more accumulated mutations. So as of right now, it looks great, more infectious, not more lethal or virulent, and the vaccine will be able to cover for it. Okay, great. Okay, so lastly, let me just say from what we know from experience with this mutation, it's unlikely to have a large impact on vaccine-induced immunity. So that's good news. Now, several nations have identified another additional variant that was first identified in South Africa, and this too also appears to infect folks more easily. Now, this also has that same configuration. So the mutation does the same thing, right? So if this is the spike protein, that B117 mutation, let's say, kind of makes it look like that now, right? And of course, I'm making this up for illustrative purposes, so that this, again, binds to the ACE2 receptors easier. But there's a rub on this, and that is that even though both of these, the UK strain and the South Africa strain, they both arrived at that mutation. The mutation was the end effect, but how they arrived at that mutation, they did so differently. And for this South Africa strain, it did so with a mutation at the gene point at 501. Now, that is the area of the gene where the spike protein is made. So the South Africans, this virus was named B1351. The South Africans have changed it to 501V2 because they are calling it version 2. Now, what is notable about this, and what I'm sure you've been reading about, is that preliminary studies have demonstrated that people infected with this variant carry a heightened viral load. So this is preliminary again. And remember, with coronavirus and COVID-19, a higher viral load is associated with with symptom severity. So we've seen multiple studies documenting that. So this is, again, very preliminary. But if this is true, that because of this 501v2, for whatever reason, people are more likely to have higher viral loads, this could potentially impact the severity of disease. So again, this is all very preliminary. We're going to watch it. Okay, now if this isn't already enough, there's a third variant that is emanating from Nigeria. This does not appear to be more severe, but we're going to definitely be watching that. Now, the CDC says it plans to launch a national strain surveillance program this month, so that is definitely very, very necessary. There's belief that the UK strain is estimated to represent about 1% of all infections in the US, but at this moment, because of increased contagiousness, the best estimates are that it will likely be the majority of new infections, as I indicated, by March. Okay. So where is this 501v2, the South Africa strain? It's been found in the UK, in Switzerland, in France, in Japan, in Austria, in Zambia. And why is it getting all this attention? Again, it's because of that mutation that I mentioned. And the issue here, as my cat is freaking out, the issue here is that not only could it induce a higher viral load, which could be potentially problematic, it's that also that mutation has been seen in people who have natural immunity. So not vaccine immunity, but natural immunity. For people who have natural immunity, that mutation can decrease the antibody production by a 10-fold factor. In other words, this South Africa strain, for people with natural immunity, there could be a 10-fold factor of a decrease in antibody production, and that could be really problematic. Now, what we don't know is what about immunity that has been established as a result of vaccine. That's the question. So again, the big take-home messages here with these with these variants are this. One is that the so-called UK strain, the B.1.1.7, it is more transmissible, it is not more lethal, and unlikely to be affected by the vaccine. For the South Africa 501v2 strain, it is more contagious. There does appear to be a greater viral load in patients affected with coronavirus, which could affect symptom severity. And then lastly, there is definitely a question, and studies are definitely needed to determine whether or not vaccinations will, and certainly which vaccines would be best for this 501v2. Okay, so there it is. Stay on the lookout for our regular updates and and to read more from these sources that were used in this report. Please go to the acoi.org/COVID-19. Together with the ACOI, we'll help you have the latest information to help you respond to your patients, stay on top of this crisis. Please feel free to reach out to me, Dery@mac.com, anytime. Please stay safe. We can do this together.